Hey YouTube, and welcome to another edition of the Nurse Lounge. So since school is out for most students, I wanted to talk about 5 assumptions that are made by nursing students in general. This is not everyone, but in general. So this video is for those who are pre-nursing, meaning that you're taking your prereqs right now. Those who are just considering nursing, they haven't really applied for any programs or even really went into that point, but they're thinking about it. And those who are obviously next semester who will be continuing their education into their nursing programs. So this is for you. So if you're interested, definitely stay tuned. All right, so 5 assumptions made by nursing students in general. Assumption number 1 is that anyone can become a nurse. And this is true and this is false. So what makes it true? If you are committed to nursing, you're wanting to sacrifice, you're willing to do what it takes to be a nurse, you have the grades to enter nursing program, then you can be a nurse. On the flip side of that, those who have less than the GPA requirements of most nursing programs, which most programs are requiring at least a 2.5, I want to say 2.5 or 2.8 to get into their programs. The more competitive programs are requiring above a 3.5. And so if you're not meeting those GPA requirements, I would recommend that you go back and repeat some of your classes that you made C's in so that you can be competitive in the applicant pool for nursing. Also, what makes everyone not eligible to be a nurse is that some people aren't willing to make that sacrifice that it takes for to be successful, meaning that you're going to continue to party. You're going to continue to go out with your friends every weekend. You're going to continue to indulge and engage in reckless activities. Nursing school does not allow time for that. You have to be focused on your studies and learning your skills and professionalism and how to maintain those. That's what's going to take you to graduation and beyond and make you an astute nurse. Assumption number 2 is that all nurses do is sit at the nurse's station. This could be furthest from the truth. That may be what people see, but what they don't see behind the scenes is the fact that we as nurses, registered nurses, manage patients' care. So what that means is, yes, the doctors do put in the orders and say, do this, 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 and this, put in the Foley, take the IV out, put the IV in, do this, pass these meds. Yes, they do say that. But who determines whether we actually give a medication or not is the actual nurse. So let's say, for example, somebody has a lower blood pressure, but they're scheduled to get a medication that's due at 9 o'clock in the morning. But when you went in to do your assessment, you found that their blood pressure was 90/40. Now, if they're getting 1,000 milligrams of labetalol, which is a lot, you may want to think about as a nurse, should I give this medication considering this patient's blood pressure is already 90/40? That's what we have to decide. We have to critically think and think about that's not safe. And so therefore, I'm going to call the physician and say, hey, this blood pressure is 90/40. I did not give this medication. I wanted to make you aware. And then he or she's going to say, hopefully they're going to say, okay, that's fine. With that being said, we manage their care. And then just imagine, in nursing school, you have 1 or 2 patients that you care for. But in the real world, we have 5 or 6 or more, depending on our patient population. In ICU, they have usually about 2 patients. In OB, I have about 6 patients. That's my ratio, where we have 6 patients. In ER, I'm not sure what their ratio is, but they have patients coming in all the time. When it comes to long-term care facilities, LPNs can have 15 to 30 patients that they have to manage their care for. So we do a whole lot more than just sit around and waiting on a physician to come and say, hey, put this Foley in. Also keep in mind that physicians only round on their patients typically once a day, and they see their patients for up to 15 minutes. So who do you think is caring for the patient the other 11 hours and 45 minutes of that shift? It's you. You have to figure out and know the trends and what's going on with your patient to know whether we're doing something good, something bad, or which way are they trending. And we have to notify the physician and let them know appropriately what interventions need to take place based off of our assessments of our patients. Okay, assumption number 3. A nurse is a nurse is a nurse. This could be further from the truth. So, for example, I've had people come to me and say, hey, my heart is not working properly and the doc is recommending that I get a pacemaker. What do you think? And I honestly have to say, I don't know, because I don't do telemetry. I don't do cardiology. I'm not a cardiac nurse by any means. I'm an OBGYN well baby nurse. So therefore, I'm not going to know. Same is true. You can expect the ICU nurse to know everything about OB because they were not trained in that area. Now, when it comes to nursing in general, yes, we all had some foundations in nursing school where we had a little bit of everything. However, once you graduate and move into your specialty, you kind of lose a lot of that and you really focus on your specialty. So that's where you're trained at. The only caveat to this would be where a nurse has trained in multiple areas. So therefore, he or she may know more about multiple areas. But as a general rule, a nurse is not a nurse is not a nurse. We don't know everything. Okay. Number 4, nurses make a lot of money. I don't know why people think that, but part of it is true. And let me tell you how. So when you compare someone who has an associate's degree as an example, so someone with an associate's degree is going to make X amount of money. Well, you take a registered nurse who has an associate's degree, he or she is going to make more money with that degree than the typical associate's degree recipient would make. So in that aspect, it is true. Let's take a bachelor's degree as an example. So maybe you have a bachelor's degree in psychology. Okay, well, if I have a bachelor's degree in nursing, I will likely make more money in nursing with a bachelor's degree than I would with a bachelor's degree in psychology. In fact, I know in order to make money in psychology, because I have a degree in psychology, that you would have to have your master's and or PhD in order to make what I even make in nursing with my bachelor's or master's degree. So it is money to be made, but you definitely have to work for it. So those nurses who are making those 6 figures who just have bachelor's degrees, they're working for it. Believe me. They're working overtime, they're travel nursing, they're working second and third jobs. They're making the money, but they are definitely putting in the work. So be mindful of that. And assumption number 5, as a new nurse in a hospital setting, you will have to work nights, weekends, and or holidays. So I don't know why new nurses assume that they won't have to do this, or I've met nurses who are bent out of shape because they got a job and they're wondering why they have to work Halloween when they have a child, and on and on and on. This is what you signed up for, sis. This is what you signed up for. When it comes to being a nurse in a hospital setting, we are required to work. Some of us are required to work nights. Most new grads go to night shift. However, there are a few new grads who will be able to work days. But most of us go to nights. But you will be working holidays and weekends. That's just part of it. Understand that not holidays, but hospitals are open 24/7. They don't close for anything. So therefore, like for the holidays now, nurses are going to be at the hospitals working. And sometimes families don't understand why you have to work all these holidays. This is what nursing entails. This is what we have to do. So we do work nights. I worked my fair share of nights for years. We do work holidays. I'm not working this holiday, but I did work my Thanksgiving holiday. And we do work weekends. And I have to work my fair share of weekends. And that is required of us in order to maintain our jobs in the hospital setting. So if you're wanting to become a nurse, keep these things in mind, that you will have to work nights, possibly holidays and or weekends. And that is required in order to maintain your job. All right, so that takes care of those 5 assumptions. Thank you all so much for watching. This has been a great opportunity for me to kind of discuss some things that happens within nursing and things that for you to think about, kind of like food for thought, things for you to think about regarding the nursing profession. And should I not, should I continue? I want to have a realistic expectation of what you can expect once you complete your nursing program, or for those who may be considering nursing even as a second career. So you already have a career and you're saying, okay, you know what, should I go into nursing, something I want to do? Just know you're going to be busy. You're going to be busy. You're going to have to sacrifice a lot. There's money to be made. You won't know everything, but you will know some things, and you will be great at what you do if you definitely put the energy and work and the sacrifice into it. All right, so thanks for your time. Happy holidays. Um, I really wish everyone the best for the new year. For those who are starting into the nursing programs in January, I wish you the best. For those who are continuing, I definitely wish you the best. And those who are considering nursing, feel free to ask any questions or have comments that you want to ask regarding nursing. There's so much to know when it comes to nursing. As always, please comment, like, share, subscribe, everything, so that I can know that you are definitely into this as well as I'm into this, and that this has been instrumental in helping you. I thank you for your time. Again, happy holidays and take care.